I'm Dr. Ruth Totten. I'm a board certified adult psychiatrist, and today I want to talk about food addiction. So, food addiction is not a diagnosis in the DSM. There's also not yet any consensus among the research community about what the definition of this should be or what should be included in the food of this food addiction. However, there is a lot of anecdotal evidence and people's lived experience to say that this is a real phenomena. But that being said, there is certainly a significant amount of controversy around this topic. Let's talk about why that might be. I think that a large part of it is that a lot of the treatments that we have around people who have mental illnesses related to food have to do with normalizing exposure to all types of foods and everything in moderation, and that if you're going to be restricting any type of food, that is a symptom of the illness. And so the idea that someone may have a mental illness related to food that requires abstinence, which is what we would usually recommend for treating an addiction, that really is contrary to the treatment that is currently standard of care. And of course, you can't abstain from food, right? You need to nourish your body. That being said, there are certainly individuals who have tried the current traditional treatment for mental illnesses related to food and tried the everything in moderation approach, and that just has not worked for them. People are in this type of treatment for years and years, and they continue to try to struggle. So for those individuals, I think that it's worth considering that some people may benefit from a different approach. So you may have come across the concept that some people are moderators while other people are abstainers. And so those people who would consider themselves to be moderators can say, I can have a cookie or half a cookie and I'm satisfied. I don't have to keep going. Whereas those people who are abstainers would say, I cannot just have half a cookie or a cookie. I need to have the whole container. And for those individuals, in order to have a healthy relationship with food, they feel that they need to abstain from eating those foods and that they have freedom in that abstinence. But it gets really tricky whenever it comes to something nutrition related, because I think there's a tendency in that field to say that there is one right answer. And so it can be like a minefield for patients who are just trying to find a solution for them that enables them to have a healthy relationship with food. So if someone says, I really do best if I just don't eat sugar at all, or maybe I really do best if I eat almost no carbohydrates at all, I think that rather than saying that is unhealthy for that individual, it might be a more productive approach to ask that individual about their experience and how they've come to that conclusion and what it's been like for them. Now, I say all this with a caveat that, of course, if someone is restricting certain foods or certain food groups from their diet, and I'm talking mostly about things like refined sugars, carbohydrates, and just even carbohydrates in general, because these are the things that people tend to crave and to have addictive behaviors towards. Most people aren't overeating protein and fat. They just don't have that reinforcing quality that carbohydrates can. So if someone is restricting their carbohydrates, it's so important that they are replacing those with healthy protein, healthy fats, that they're getting enough micronutrients. So my question for you all is, how do we navigate this conversation around helping people to find what is a healthy relationship with food for them, even if it goes against what sounds normal to you or the central dogma? Share your thoughts in the comments below.